I trained in Oxford as a medical student, did my clinical training there, and then became very interested in orthopaedic surgery. So I trained in orthopaedics in various places, including Oxford, Birmingham, Adelaide, and then back to Oxford again. When I first started in Southampton, I based my private practice here at the Wessex Nuffield Hospital. I've always enjoyed working here. It's a great atmosphere, great staff, good teamwork, and really good management. So it resonates more with my values, which are looking after patients to the best of my ability in a supportive environment. Hip surgery is all about getting consistent results, careful planning, careful execution of surgery, and looking after patients so they don't get problems. Where the Mako is important is it makes you think very carefully about the anatomy that patient has, what you're trying to achieve in terms of surgery, and delivering that time and time again, consistently and safely and reliably. So Mako is, I think, an important technological change in what we do, because it gives us a very careful and accurate preoperative plan, which you might not have had in the past, and where you might just rely on your own experience and training to deliver a good result. The Mako sort of narrows the error bars down so that you're doing the surgery more consistently every time. Every hip is different. No two hips are the same, and that's what I enjoy as a surgeon, is thinking about what I'm doing and try to achieve the best outcome possible for that surgeon. It's a wonderful operation to do. We work with fantastic equipment, wonderful implants, in an operation which is probably one of the best operations of the modern era in terms of the numbers done, the success rate of hip surgery, and the way it transforms people's lives.